Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Welcome back to another episode of the Smile Sisters.
Hello.
So today we want to talk about something that we all kind of know and deep down inside, but we try to ignore it. And that's that there's really no quick fix for a lot of things that we want a quick fix to.
Yes. I was thinking about a patient that I actually had yesterday.
Mm-hmm.
And he came in, he is a new patient to us, came in, moved here from North Carolina, had bonding done on his 10 upper teeth and 8 lower teeth, less than a year ago, he said.
Right.
And he came in because 9 of them have completely fallen off, and another 4 or 5 had fractures in them, so they were broken.
Okay.
Right. So most of them had failed, pretty much.
Right.
Within a year. And he was in here and he wanted me to repair them. And I looked at his bite, and his bite was really bad. His teeth were edge to edge, which means his upper teeth and lower teeth in the front, when he bit down, came together so the edges were touching. Now, this is something that we don't actually want. Sometimes people think that their upper and lower teeth in the front should come together like this, but really we want to have a little bit of an overbite. We want our upper teeth to be a little further in front of our lower teeth.
Right.
And I talk about this often with patients and say, think about your lower teeth as a shoebox and the upper teeth like the lid to the shoebox. You want that lid to kind of surround on the outside.
Right, but just a little bit. You don't want it to like go all the way down, because then that's also...
You just want like a little overlap. Overlap forward and overlap down like this on top of each other, but not fully down. So that's what you want, and that saves your front teeth from breaking when you're chewing. Because when we chew, if we have an upper tooth and a lower tooth in the front, when we chew, we're moving our lower jaw side to side.
Mm-hmm.
And if our upper and lower teeth are edge to edge like this as we chew, we're going to rub against that and fracture it. But if we have a little bit of an overbite right there and we chew side to side, those teeth don't touch. Right? And so we save them. And then when we want to bite into something, like an apple, think about it, you bring your lower jaw forward.
That's when you bring them edge to edge on purpose.
And you bite into
to slice into something.
And then you slide your jaw back, and then you chew in the back.
Right?
And so if your front teeth are edge to edge, that just totally destroys them as you're doing your normal function. So it's not even about wearing a night guard. Often dentists are saying, well, just wear a night guard, it'll save it. But it's from normal function that you're destroying
and this
your
is
teeth.
something that I was thinking about too. Like, we do recommend night guards, but how many times has someone come up to you and said, I woke up and my tooth was chipped? Most of the time people come in and they're like, I was biting into cottage cheese, like the softest thing possible, and then my tooth chipped.
Yes.
And that has to do with that envelope of motion, that kind of like chewing motion where the teeth hit.
Totally.
So most of the time, teeth don't chip while we sleep.
No.
They chip when we're eating, even if it's something very, very soft.
Yeah, true. I mean, there's 2 aspects to that. You can have a functional malocclusion, that means that the teeth are not in the right place. So when you function normally, they get ruined.
Right.
And then you can have a parafunction, like you can have a habit of really clenching and grinding your teeth, which can do damage, but it doesn't solve the problem of the malocclusion, of the misalignment of the teeth that you have. And you can't just wear a night guard at all times.
Right.
Although some people do, and then you want to eat, you got to take it off. So anyways, you need to fix your bite.
Yeah, you need to fix the eating portions of your life.
Yes, exactly. And that really, you have to have your naked teeth. Like, you can't be covering them up all the time with something. So that's a problem. So this patient yesterday, and our fees, we gave him a fee to repair it, and I told him, I cannot even guarantee that these will last you.
Because of the bite.
Because of the bite. But he was filming a music video and he wanted to get them fixed and all of that. And I had a long conversation with him about, we need to fix your occlusion. We need to do some orthodontics and move the teeth into the right position. Then adjust the bite. He goes, I can't, do this for a year, which would take about a year to, let's say, align the teeth. I don't have a year. I'm like, well, then the other option is to literally shave the inside of the upper teeth, the outside of the lower teeth, to, create that overlap that you're missing,
Right.
which I don't necessarily recommend. But he said, I don't want to shave my teeth.
Right.
Fix it. I don't want to move the teeth. I don't want to shave the teeth.
Right.
I want you to fix it and have it last me, and I
Yes.
don't want to pay higher fees.
Sometimes we're presented with impossible situations where there's just nothing that we can do as dentists that's going to be a long-term good solution with all these obstacles, like the time, the money, and then of course reducing tooth structure, because you can always shave the teeth down and do whatever you want.
You really could.
Yeah.
I mean, and I don't advocate for that, and it's not something that I do necessarily.
Right.
But I wanted to present that as a potential option out there. Either we adjust the bite by moving the teeth, or we adjust the bite by cutting the teeth
Right.
in certain aspects to make it have an overlap. Or else I don't want to repair these. And if I repair them for your music video this weekend and they fall off on Monday,
Yeah,
that's,
then
I
it's
can't,
what
I
can you
can't
do?
fix it.
Yeah.
You're paying for it again. And so it's not treatment that I want to do.
Yeah, when the teeth are in the wrong position, it really affects everything else. There's not much we can do without really cutting into the teeth if they're already in the wrong position, because
Yes.
we cut them so that we can pretend to move them to the right position. And way back when, they used to even make dentures to make teeth look straight.
Right.
So
Yeah.
before, I guess, all this cosmetic.
Your teeth are crooked. I have an idea. Let's take them all
Yeah,
out.
they would.
Yeah.
They would actually take all the teeth out and give you a full set of dentures so you could have straight teeth.
Right.
But I mean, if the
So
teeth,
terrible.
the point is, we're not going to do that. The point is, if the teeth are in the wrong position, you have to either cut them or just remove them. The only other thing we can do is orthodontics to put them in the right position,
Yes.
and that's what takes time.
But this is the idea of a quick fix. He went in somewhere. He said he had the bonding done for I don't know. I feel like probably between $100 to $200 a tooth. I'm not really sure.
Right.
Which is way below the fees that we charge. But again, this sort of thing requires planning. We do a smile design. We look at your occlusion. We recommend orthodontics first to put the teeth in the right place, so we don't have to shave the teeth.
Right.
So most of the cases we do with cosmetic work, like veneers or bonding, we have done some orthodontics first.
Yes.
In order to avoid having to cut into the teeth. So all of this stuff requires more of your time. It's not a quick fix.
No, it's
and
really
that's just
not.
the reality
Yes.
of how it is. It requires work. It's more expensive because it takes more time and more effort, and we
Yes,
plan these things
and more
out.
planning and thoughtfulness has to go
then-
into it.
Yeah, but then you won't have 10 of them falling off.
Well, it's
within
like the
next
patient
year.
who comes back from Dominican Republic or something, and 5 of the veneers pop off in the plane, and they're like, was it because of the air pressure?
Right.
No,
It's not your air pressure.
it's not because of the plane.
I actually have a patient coming in for me to remove all the bonding she had done in Colombia last April.
I know. I mean, we see not that everybody in Colombia is bad, but the quick fix is the
the
problem.
issue, yeah.
It's just about trying to solve something that requires a little bit more thoughtfulness, a little bit more time, and then trying to do it quickly and cheaply. Those things don't always work together.
Yes, and this is not to, say that everyone, if you go out of the country to get work done, that it's bad. But often because it's done in such a limited amount of time, you're
Yeah.
flying in, they're not sitting there talking to you about doing orthodontics first
No,
and then
no.
returning in a year,
A lot of those type of quick is a lot of cutting into teeth.
It really
They
is.
really have to, because like we're saying, there's no way to move the teeth quickly, so you have to either cut it or remove it. Those are the only other solutions, and that's what ends up happening, is that they end up cutting into the teeth a lot. Now you can get the right positioning and the right aesthetics.
Yeah, and so, my job, I feel like most of the time is just talking to the patients about this.
Yes.
Just sitting there having the same conversation over and over every day.
Yes.
About why it's important to do these things first, and educating. And this should be our main job anyways. I believe that it is.
Yes.
And once people do realize that, most people are willing to kind of do things the right way, especially if you've done it the other way and seen it fail.
Yes.
And so we don't have solutions other than take the time and do it right.
Yeah, we don't.
Right?
Well, there is a video of you doing a bonding online that has like lots of views
Right.
of just repairing a chipped tooth or something.
Right, but the occlusion is right.
But those are, yeah, that's what I was just gonna say. These online videos, even the ones that we make, are not always realistic to every person's situation. Like
Exactly.
teeth chip for multiple reasons,
Right.
and you have to understand the reason behind it before you can just quickly fix something. Because the quick fixes often don't work. The reason it is chipped is what we have to figure out first.
Totally. We got to address the cause behind it.
Yes.
And it could just be that the bonding failed for some reason.
Yes.
It wasn't glued on properly.
Or it got
popped up.
discolored or something.
Those things can happen. And
Yes.
these are ultimately easier fixes. But if it's
Yes.
because of occlusion and issues like that, often I get patients who come in, they're like, I chipped my tooth when I was 12 and I had this filling done on it, and now it stayed for like 20 years, but now it pops off every year.
Yes.
And then I look at their lower teeth, and their lower teeth are crooked like this.
They've moved.
Their lower teeth have moved, and before, when they were a kid, the teeth were straight, they had had braces, and so occlusion wasn't an issue. But now it is, because they stopped wearing their retainer, their lower teeth moved. So often
Right.
I'm telling people, if we're doing bonding on the top, you need to wear a retainer on your lower teeth as well.
Yes. You got to
Because
maintain
over
the
time-
whole system working together
Totally, yeah.
for everything to work well. It's not just about one single tooth. It's never about a single tooth.
Yes.
It's always about the whole thing working together in harmony, and that's how we can make things last a long, long time.
Yeah. So talk to a provider that is willing to sit with you and explain why something is failing. Really understand, first of all, why something is failing for you,
Yes.
and be able to give you solutions that are going to be long term. And this often means the treatment's going to be a bit more expensive. But if that's the case, and you understand the value of what you're getting, it makes sense.
Yes. And I also want to mention that when things are working well together in harmony, it actually looks better too. So the function and the aesthetics really go hand in hand. When the teeth are biting in the right way, it has good lip support, like your lip, your nose, your smile, all of these things, affect each other, and the positioning of the teeth in the correct position is what we see as beautiful. When they are, crooked or misaligned, or the bite is off, that's what we see as less beautiful. So when things are working correctly in harmony, it's also the most aesthetically pleasing result.
Yeah, that's true.
Yeah.
So come and get a consultation.
Yes.
And find out, and be open to taking the time it takes
Yes.
to do things correctly, so it can actually last you and your treatment can be predictable.
Yes. Check us out at LA Dental Clinic. We offer free online virtual consultations, and hope to see you. Bye.
Thank you for listening to The Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.